Good morning, good afternoon, good evening. It's a pleasure to welcome you to this interactive workshop entitled Actionable Insights for Inclusive Healthcare in Africa. My name is Afia Basoa. I'm Head of Healthcare Strategy at RAP and the Chair of the UK Board of Trustees for the international NGO Mothers to Mothers. And I'm delighted to be facilitating today's 90-minute working session. The session is the first of a series of meetings that will take place in recognition of the need for accelerated learning from innovations that were unlocked by community responders during the COVID-19 crisis. In the past 2 years, the COVID-19 crisis on the African continent has led to catastrophic loss of livelihoods, disruptions in schooling, and fraying safety nets as governments and international organizations struggle to provide access to care and keep their populations safe. At a time when mainstream support systems have been overwhelmed, social entrepreneurs and community health workers have consistently stepped up to fill the gaps, especially in hard-to-reach poor and rural areas. These community responders have demonstrated the capacities of innovation that can be unlocked when they mobilize science, technology, government, and the private sector to act in concert to respond to the systematic challenges seen. The initiative we're launching today is hosted by the World Economic COVID Response Alliance for Social Entrepreneurship and supported by the Bayer Foundation. It builds on the success of the India's Last Mile Responders campaign that has highlighted vital lessons from 50 social entrepreneurs and the bold response mechanisms that emerged at a time when new COVID-19 surges threatened across the globe. The Alliance's African effort further leverages the strength of the Bayer Foundation with its vision of catalyzing advances in science and social innovation for a world with health for all and hunger for none, empowering social innovators as enablers of long-lasting change. And this is deep in the heart of the foundations. Its social innovation activities focused in sub-Saharan Africa really looks at the intersections between health, agriculture, and environment. The joint initiative is a great way to collaborate with other foundations, funders, and stakeholders with the view that together we can build a community, a social innovation ecosystem that contributes to a more resilient and inclusive health system for all. The first phase of this innovation really focuses on collecting evidence and showing the art of the possible through actionable and innovative solutions. These insights will highlight successful and unsuccessful solutions that were deployed to address inclusive health challenges during the COVID-19 crisis. The outcome will pave the way for resourcing and scaling of innovative mechanisms to address key systemic challenges that social entrepreneurs face in Africa. The first step we need to take to arrive at actionable solutions is to recognize that social innovators and entrepreneurs focused on health services do not conduct their activities in isolation. Rather, they work within complex systems that expand towards or expand outwards from local, regional, and national, and ultimately, actually, global level. It's important to understand how they partner with one another, how programs and services are integrated with government health systems, and how they impact and influence service delivery at front lines of healthcare. By examining these types of radical collaboration via the lens of COVID-19, we're allowed to examine what, why, and how actors are enabled to build capacity as system influences in developing and promoting linkages and networks, thereby acting as mechanisms for achieving true systemic change. The goals we want to focus on today are four. The first is to explore the actionable insights and innovative solutions developed by social entrepreneurs to foster inclusive health systems across Africa. The second, to assess the role of intersectionality within health ecosystems. The third is to examine the potential impact evaluation framework to be applied towards solution. And the fourth, to assess the geographic and regional scope of the actionable insights. Why? Well, we believe your insights into community-based organizations and social enterprises can help create more inclusive health systems. Your insights will help us develop a high-level framework of the ways in which other organizations can help make health systems more inclusive. Now, I want you to imagine the year is 2035. The promise of tech-enabled innovation and people-centered policymaking has resulted in a world that is safer, with more resilient and inclusive health systems. I invite you to use the chat function, and please just use 3 words only to describe what you feel contributed to the establishment of this, our inclusive health system in 2035. So please just take a minute to use your chat function and drop in 3 words to describe what you feel contributed in 2035, we're thinking in the future, to all of us establishing this inclusive health system, wherever you may be. So I invite you to do that. Just take a few seconds to do that, please. Fantastic. So keep those words coming in. What we would love you to do is, whilst we progress through today's session, keep those words in mind. And once you continue to pop your 3 words in, I will quickly just take you through the planned agenda for today. So Dr. Francois Benici, Director of the Shrub Foundation of Social Entrepreneurship and the Head of Social Innovation at the World Economic Forum, will provide framing of what an inclusive health system actually looks like. We will then break into 3 breakout groups for 45 minutes to garner actionable insights from all of you regarding the building blocks and challenges of creating inclusive health systems. Importantly, we'll discuss how community-based organizations and social enterprises might contribute to advancing inclusion. The 3 groups will also then spend some time focused on the areas that I mentioned earlier, so the geographic and regional scope, the intersectionality, and the impact evaluation. We will then regroup and share out some of our key insights before closing out. Now, just a couple of housekeeping remarks before we kick off. Please remain on mute until we get into those breakout discussions. Please do use your chat function to share your thinking. We'll ensure that whatever you put in the chat is addressed either today or as a follow-up. We are incredibly excited to have your active participation. No idea is a bad idea. All input is incredibly valuable. And so with that, I would love to invite Francois to the floor, and thank you all for your participation.
Thank you so much, Thea, and delighted to be here. Maybe one other housekeeping is that the session is being recorded, just so you're aware that mostly for internal purposes in terms of using this session to really get the most out of shaping what is a really early stage initiative. So first of all, I'm Francois. Thank you so much to everyone for coming. Thank you to Sankalp for hosting us. As usual, I probably will not stick to the script that I've been given, but I will try stick to the time. The first thing I wanted to do, I think, was to really acknowledge, the deep experience in the room, and a big warm welcome to many colleagues and friends and people I've perhaps known personally or not known personally, but I know have been committed to building inclusive health systems for many, many, many years. And we have some real pioneers here today. And so just wanted to put a real recognition that the expertise lies in the room. I'm not here to necessarily give a definition of inclusive health system, because I think I can set a bit of the scene, but I really wanted to recognize the deep commitment and work of everyone and the organizations that have come here today, both from practitioners, academics, advocacy groups, networks, the foundations, and private sector as well, that are committed to all of this. Also, a bit of quick context. The Schwab Foundation for Social Entrepreneurship is based in Geneva. It's a sister organization of the World Economic Forum. I think most of you may be aware of that. We have an amazing array of organizations that we have curated in the community through our awards program over the last 20 years, some of whom are here today. Tulsi, I see, from Aravind, Frank from Mothers to Mothers. I think Last Mile Health, North Star Alliance, others are here. So just a recognition of a long history of that. And then during the COVID pandemic, as part of a response, on the World Economic Forum platform, we built the COVID Response Alliance for Social Entrepreneurs, looking really at the ecosystem actors that were looking to support frontline organizations and help in some way to coordinate some of those responses and recognize what was needed, and that we needed collective action and collaboration on many of these topics. And many of those, some of those members of the Alliance are here today. Ecosystem actors, Bayer Foundation has been mentioned already. There have been amazing in the work they've been doing, but also in catalyzing this new initiative and conversation. But of course, many others, Impact Hub, Johnson & Johnson, LGT, Motsepe Foundation, and others. So just to recognize there's, over the last few decades, there has been an ecosystem supporting social enterprises, and that the World Economic Forum has been one of the few institutions to continue to put social enterprise and keep social enterprise on a global agenda. What we're here to do today is to really look at the work you've been doing all for many years, and start to recognize that we need to go beyond advocating for one single solution that might drive inclusion or might improve access, but really look at what are the lessons. And I think we've seen certainly in community health, and many organizations here have already been working collectively and advocating for stronger digitally empowered community health solutions that are starting to integrate or work alongside both private and public sectors. But there are many other aspects to inclusive health systems that need to be built. And I think both the belief here is that this sector has something important to offer, as many actors are responsible for driving inclusive health systems. So as you can see a little bit on the slides, the concept also represents a radical shift in health policy that focuses only on medical outcomes to the broader concept of inclusion, provision of quality of healthcare throughout the life cycle, but also thinking about the broader dimensions of inclusion, and we'll unpack some of those today and speak to the issues that I think some people raised around justice, around equity, but also intersectorally of the spheres of human experience in different sectors, food, water, sanitation, etc. These are many of the social determinants of health that many have been working on. I think there's no argument, given the people in the room, that this is, a common mission that we have. It's clearly a common mission of the Sustainable Development Goals. It's a common mission of Alma Mater Declaration and of many particular countries' health systems and health policies. The challenge is always in the realization of that and thinking broader about what inclusion means. And I think it's not only about the outcomes we seek, but also how we do the work. Clearly, some of you know I've been really interested in how we learn to do deeper systemic work, and so much of that is about the process of change, not only who gets access and who is the recipients of an inclusive health system, but also who benefits and who actually is providing the health services. So I think, there's so many dimensions to inclusive health. So really wanted to just set a little bit of a frame for today and recognize, the context we're doing this isn't necessarily a new conversation to many of you, but I think we have an opportunity because of the platform that's provided, the convening power of the forum at Sunculp and this initiative we're taking forward with your input, I think can help to build and advocate for and take some of the actionable insights that Afia was talking about, and we'd like to start elucidating today to say these are ways in which these actors are part of a health system and can actually help to advance inclusion on a number of important dimensions. As I said, I would try and stick to time, so I think I'm over. So that's it from me, and a big thank you to everyone for coming and the team for hosting today and our facilitators. Thank you so much.
Thank you very much, Francois. And thank you all for your 35 words. I think the theme that emerged, we had a lot of digital and tech, partnership, trust, social justice, and collective impact with regards to how we're going to get to those inclusive health systems. Now, through the power of technology, I'm hoping that we will automatically be taken into our breakout rooms. As we mentioned, there are 3 breakout groups. We will be in those breakout groups for 45 minutes rather. And when time is done, we will automatically be brought back into the main room. So you don't have to do anything. And you have already been pre-allocated. So you simply need to hold tight. I now defer to my tech gurus to make this happen. If we can go to one of the 3 great breakout groups now, that would be great. Super. I hope you enjoyed your breakout sessions. What we're going to spend a few minutes doing now is just hearing back from the group with regards to some of the key discussion topics that were shared. And so can I invite maybe Karina, I see you on my screen. I don't know whether you'll feedback or whether you have a representative from your team, but maybe just share with the team what your discussion area was and what some of those key discussion points were.
Yeah, thank you so much. Unfortunately, I couldn't find a volunteer, so you have to hear more from me. I'm sorry. So my group, group 1, we talked about kind of the main question: what are the building blocks and challenges of fostering inclusive health systems? And there, the main points were that leadership plays a big role on different levels, both kind of across regions and continents on a multinational level, as well as national, and then kind of triggering down to the community level. And I think there was a stark notion that especially this community level is so important in defining and contributing to building inclusive health systems, and that there is this massive disconnect, which then I guess is a challenge between both the different actors in a health system. There is isolation, people are acting in silos, there's a lack of communication, but then also kind of throughout the different levels of a health system, especially between the national and then the community level, there's a big disconnect that then kind of stands in the way of fostering inclusive health systems. We also learned about a couple of examples of successful partnerships with the private sector, also with the public sector, with the Ministry of Health, and got a lot of insights into how kind of private capital that is put into social impact first initiatives and businesses can really contribute to foster inclusive health systems as well. And then also touch base on the importance of trust, mutual respect, and then also leveraging on the experience of the different players and their strengths, while being open to incorporating other approaches and incorporating kind of other experiences as well, especially when we talk about partnerships. Our second question focus was about geographical reach. So are there examples in specific regions, in specific countries, in specific communities that will be really interesting to look at for this initiative? And there we kind of captured learnings from Rwanda, right? Rwanda as a case study from kind of a conflict-torn country 25 years ago to the country with the universal access to healthcare now, with a really strong healthcare policy, building towards a very inclusive health system. The case study of community health workers in Ethiopia and how they are really bringing access to healthcare into the last mile. Then Ghana, where the government has spoken very openly about fostering public-private partnerships to achieve inclusive health systems, and also how to incorporate digital technology in doing that. And then I think the last mention was on Kenya and the work AMREF has been driving here, also with community health workers, to bridge some of that accessibility challenge into rural communities. So yeah, I think that was a quick summary of our session. I hope I didn't take too much time, and I'll hand over to you.
Super, thank you so much, Karina. Good discussion. Emily, can I invite you or a member of your team to share out some of the...
Sure, thanks so very much, Afia. We had an incredible discussion. I was really, really excited to see the participation we had and the really diverse schools of thought that we had in our room. And we talked about, what are the building blocks of inclusive health? What are some challenges to achieving that? And then finally looked at the role of data, both qualitative and quantitative, and how that might look. Do our current methods of impact measurement actually meet an inclusive health environment should we achieve it? I just want to give really brief oversight, and then perhaps someone from my group can speak for just 2 minutes. We had a lot of really, really great discussion. I think some of the biggest themes that emerged were about patient-centered care. They were really looking at not only are things affordable and accessible, but also how do patients navigate? Even if we create an inclusive system, how do patients have the awareness of that system? How do they feel empowered to engage in that system? And how do they understand how to navigate through that system to get their care? When it comes down to the actual data portion of it, we talked a lot about, the current methods that we have. They might measure who enters into care or how many beneficiaries they are, but they aren't necessarily measuring at scale whether patients feel valued or feel that their needs are met, how they work through a health system. And also, we talked a lot about patients valuing their own care. And while we might be able to see we have X number of beneficiaries, that doesn't mean they complete their continuum of care. And that doesn't mean that they feel their own health needs are met. And that we might need to come up with some new methods of data collection to measure that. And I'll just quickly say to folks in our group, perhaps Richard, is there anything else that you would add to that in just 1 minute to help summarize our work?
Yeah, thanks, Emily. I think one of the things I raised this and supported by a number of people is the issue of collective impact. We need to make sure that we have got all the hands on the deck as far as this issue is concerned. We are working in silos, whether it's government and some partners and other partners and so on, but we need everybody to come on board to work together. And when it comes to the measurement systems, I think we also pointed out that one of the things is that they are failing to measure the entire ecosystem within which the patient actually lives, because it's not enough to just look at the interface between the service provider and the patient. But what about the social determinants of health? That's also very important to think about. And the issue of, I think you raised this, the issue of empowering communities so that they co-create the solutions. At the end of the day, it's interesting that when it comes to health, we think it's a top-down approach. But when it comes to my groceries, for example, I have to compile the grocery list myself and go to the shops. I decide. How come in health we are not doing? So I think the issue, I think Frank raised a very important point around that. So those are the things I just wanted to add. Thanks.
Super.
Thanks so much, Richard. And thank you to Group 3. We really enjoyed it. Back to you, Afia.
Thank you so much, Emily. Fantastic. So Group 2, which the focus there was, again, talking about the building blocks and some of the barriers. And we spent a couple of minutes at the end just thinking about that in the context of intersectionality. Would love to invite our volunteer, Christian, to share out some of the key discussion points from our session.
I'll be happy to, and please, group, feel free to jump in and support if I miss some points. I was given the honor to do the introduction, and I think I set us off on the topics of ecosystems, partnerships, and financing. And after I spoke a bit about that, from what I heard from most of our participants, for us, the building blocks were really a lot around digital. I think it plays into the ecosystem as well, digital technologies, and generally what COVID did to spur, but also sometimes hinder the adoption of digital technologies, which then of course plays into the access to primary and secondary healthcare and anything that's really related to dealing with this COVID crisis, but then in a larger picture really deals with providing an inclusive healthcare system, because without access to healthcare, whether that be digital access, actually being able to access the apps that are now being created or have been created, the telemedicine and all these solutions, or physical access to actually medication, to emergency support. I think that was a very emergent theme. And it was absolutely inspiring to hear from different actors. We had the NGO, we had someone from an NGO talk, we had someone from IQVIA on the research side talk. And I think, of course, the one that's always most interesting was the gentleman from Aravind, so actually on the field, telling us all of the problems he had to deal with in terms of not being able to provide access, or patients not being able to come to the clinics. Because at the end of the day, for me, that's always, once you go to the actual ground level, what is happening there. And ecosystems, partnerships, I think, is something that just has become a lot more prevalent and a lot more important, even when it was before, in bringing together all the actors, including the healthcare system, to provide that access and provide this medical support that is needed. And then maybe for the last one on, give me the word again,
intersectionality.
Intersectionality. I think I actually have to ask our members to support here.
No worries. I think we had a very very quick discussion with regards to some of the areas that some of our participants were facing with regards to health challenges or access to, and quickly talked about health with regards to mental health, health as regards to early child development, and mental health specifically associated with youth. But I think there are a multitude of other areas with regards to intersectionality that we need to consider when we're thinking about inclusivity. And so we'd only just started on that particular discussion, but we had good conversation. So thank you all for feeding back. As mentioned, we will share out some of those key discussion topics. Thank you, Christian, for sharing out for Group 2.
Thank you for helping out.
I think certainly one of the themes that have come strongly across the 3 workshop groups is this notion of connected journeys and connected experiences. And I say that with regards to verticals, so better understanding a patient journey from beginning to end, and through the lens of, or enabled by data, enabled by digital, and also transversely. So that's the collective nature. So for a patient, what are the other touch points that patient needs to be thinking about, or should be thinking about with regards to the actors in a health system. We heard about collective impact, and I see that certainly sitting across the the transverse of a connected journey. The last piece is in terms of enablement is the financial enablement of an inclusive health system. And our team talked a little bit about how important funding is and how COVID has, of course, had a part to play in destabilizing potentially some of the funding paths when we're thinking about inclusive health ecosystems. And so there were good discussions had. What we would like to spend the last few moments doing is just talking through what happens next, given some of the discussions we've had so far. As mentioned, the initiative that we were trying to garner some of these initial actionable insights. The initiative's timeline for the is really Q1 to Q3 this year. And the discussions today have really highlighted a number of actionable insights that can accelerate the ambition towards building more inclusive health systems. And I think there are a number of ways, based certainly on the group that I was involved with, in which you as actors within that health system can help contribute. And so one of the key areas may be that we act as connectors, or you act as connectors with regards to key partners and stakeholders not represented in the workshop. I think Karina's group talked about some of the geographical and regional scope and case studies. I think there might be opportunity for us to think more broadly with regards to key partners when we're thinking about the inclusive health system. The next is contribution in highlighting potential areas of research as the team think about some of the key pillars, and in terms of generating actionable insights. Participating as trusted partners. There'll be some hypothesis that the team will have initially. It will be great to have your contributions with regards to whether those are the right hypotheses, those are the right assumptions. And then the last, and really importantly, is to ensure that there is opportunity to engage in follow-up conversations. I would love to invite Katusha, who is a key member of the initiative team, to maybe just add a few words with regards to those next steps.
Thank you so much. And thank you everybody for your time and for your excellent insights. I'm looking forward to going back through and all of the inspiration that this is going to be generating, not only for myself, but for the rest of the team. To look forward to after this, you will be receiving another email from me regarding wrap up and next steps in more detail, but just would like to double click on what Afua said. Engaging in follow-up conversations will be incredibly valuable. So, it would be wonderful to keep this conversation going as I work through the next steps for the initiative. I'm going to toss it over to Ekaterina to introduce the team at large.
Hi everyone again. Sorry I'm jumping, and hi Katusha. I just wanted to give actually a shout out to everyone for joining again. I think we had such a great conversation, and I still see the comments coming from the Emily and Katusha section, and basically we just want to continue this conversation. But on practical next step, again, just to emphasize what Safia was saying, we are targeting basically next 6 months for very active research. In this, Katusha will be our main focal point in terms of the research, and Katusha is representing University of Cape Town and Bertha Center for Social Innovation, if I'm not mistaken with the name, so jump in to correct me, but she will be our main coordination in terms of research. So everything that connects to this points of testing assumption and testing idea, absolutely shoot the email to Katyusha, and she will be really excited to kind of embark on this journey and on research with you. I am working from the World Economic Forum and COVID Response Alliance for Social Entrepreneurs that Francois highlighted in the beginning, and we be, again, our key role in that will be bringing actually you all together and bringing all our partners together, both from the alliance perspective and ecosystem enablers that we have today, but also from the social enterprises, our Schwabis, the Schwab Foundation, the Minis, and also all the social enterprises that our members and our constituents are working with, and other partners that we're really going to work closer also to kind of highlight this connection point that's also playing the connector role is very important for us, but we also have the PIVA and the Impact Hub. Emily is also kind of from the same family of Impact Hub, our great partners in Africa, and for this kind of geographic scope and reaching for the partners, the PIVA kind of also will be key focal point. So that's a little bit on the team if I'm running over time, but maybe we'll pass Francois if you want to close in a couple words.
I think you've covered it all, Katja. So just a big thank you to, I think, Afia, our host, and all the facilitators. The rich insights I think we have here. As I said at the beginning, this is really a critical time I think that we have in this pandemic recovery period of recognizing the world's attention is on the fact that our health systems are neither inclusive nor resilient. And there's a firm belief that all the work you've done for so many years, is part of that answer to that. And our job is to help advocate for that. But we better do that with the support of the ecosystem actors that are here and the practitioners themselves that have been proving it, and the academics to kind of build the case. So we've got the platform, and that's our intention over the next coming months. So just a big thanks to everyone for coming today. I'm sorry we're all not at Soundcloud in person. I would have loved to have come home to the mother continent and be with you all, but hopefully there will be an opportunity for that in the course of this. And as Katja said, and Katyusha said, we'll be following up with the potential different ways to stay connected to this effort as we proceed. So wishing you all well, and thanks to all of our partners on this, as Katja said, Birthday Center, the Bear Foundation, Impact Hub, and all of you on the Alliance and our members here. So thank you so much. That's it from me, and wishing you a great further conference at SunCalp or on your days.
Super.
Lovely to see you all.
Thank you all.
Yeah, if everyone's staying, maybe we can hear from the crowd as well. If something, we still have 2 minutes actually to the conversation.
One of the things.
Punk, you want actually, I have not highlighted, but Punk from Bayer Foundation, now also our core team member. Maybe you want to also have a couple words you have not spoken today.
No problem. No, I think it's a really great discussion, and yeah, happy to get connected with the partners here, and looking forward to your insights and a continuous support into this research. Yeah. A lot of friends already joined today. Yeah, Christian, for example. Yeah, thanks for helping out. Yeah, in the breakout session.
Big pleasure. I hope everyone's a friend here. The only one.
Yeah.
Brilliant.
So thank you, everyone. Have a good day, and take care, and see you soon.
Thank you very much.
Thank you.
Have a great day. Bye.
Bye, guys.
Thank you, everyone. Bye-bye.
Bye. Thank you.